Hi, this is Jill, certified healthcare IT specialist working with KMC University to address some questions regarding the recent update or requirement to update your notice of privacy practices. And this is because of a federal regulation that started back, believe it or not, in 2024 in relation to Part 2 programs. So, Part 2 programs are programs that were pretty much funded or assisted by federal money, and these Part 2 programs or facilities treat substance use disorders, and those patient records had special protections. Up to this time, doctors of chiropractic, as well as naturopaths and physical therapists, and acupuncturists, we've already been considered covered entities, so we already had what's considered a notice of privacy practice. So what happened is these Part 2 programs really didn't have any type of notification process. They weren't able to communicate with patients about how they use and also disclose patients' information regarding SUD records. And it's understandable, these are very personal records. So, this final rule was published in 2024, and the purpose of it was to align the confidentiality requirements of these Part 2 SUD records with HIPAA standards. So, pretty much they have to do what you've been doing as a doctor of chiropractic or any other type of provider that's considered a covered entity. They have to create a notice of privacy practice. And that's what we see here on this page. It breaks down this regulation and tells you exactly what it needs to be in these Part 2 programs, Notice of Privacy Practices. Here you can see Notice of Privacy Practice and then the name of the Part 2 program. So a doctor of chiropractic is not normally ever considered the primary provider of a Part 2 program. Instead, the providers are considered lawful holders. So lawful holders are somebody who receives maybe SUD information. In other words, a primary doctor refers you, and guess what? Some of those medical records from that referral contain SUD records. So that's where we have to update our notice of privacy practice, because prior to this, um, there's really just protections for psychotherapy notes. Maybe we had to add that in our notice of privacy practice, but up to then, we couldn't really redisclose SUD records, but because of this new law, we can. So we have to let our patients know. We got to inform them, hey, guess what? We might receive SUD information, but now we can redisclose it with proper consent. And usually it's a broad TPO consent, a treatment, payment, and healthcare operations. So what we need to do? Well, before today, we would normally go to the model of notice of privacy practices. So the government's put out a model of notice of privacy practices since 2013. You can see down here the date of it is 2013. But actually, it said 2014 on that, but it's based on this law here. And they created these nice little resources. If you're working with KMC University and you actually implemented HIPAA with us, with a HIPAA specialist, we actually created a notice of privacy practice with you. We customize it. We really track protected health information. We see how you're using it, and then we create supporting forms. But if you were just going to use HHS resources, which is right here, you would go to this model and download this particular instructions and manual. We kept waiting, and that's why you're getting this information so late. We wanted to hear it from the source. Are you guys going to implement this? Meaning that, do we have to create an entire notice of privacy practice with all this Part 2 information in addition to our current notice of privacy practice? Oh my goodness. A lot of people were saying that. And that's a lot of information. It really doesn't apply. Well, the mystery's been solved. But the problem is the government put this out on Friday the 13th after 5 p.m. So they waited, even though the implementation was Monday, February 16th. So it's very frustrating. But now here's the model notice of privacy practices. So what do? If you are working with KMC University currently in your HIPAA implementation program, we're going to take care of you because you're in our program. You got that one-on-one attention. If you worked with us in the past, meaning you used us to implement your HIPAA program, we're going to reach out to you. So you're either going to get a special email that says, hey, let's help you with your model notice of privacy practice and updating it. If you are a library member, we are going to point you to the Model Notice of Privacy Practice and encourage you to review the templates. You can notice right now there's a template for Part 2 patient notice. So that's not the one we do. This is the one, the Healthcare Provider NPP. So it just shows us we don't have to put all that information in there. We just have to follow this model notice. We do highly recommend that you work with a HIPAA specialist because sometimes we don't know what we don't know. So we might be putting information in our NPP. Remember, this is a model. It's not truly customized to your clinic. So don't be afraid to reach out to KMC University for help. So how do you do that? If you went to your KMC University site, just book a solution consultation. Get some one-on-one attention to help you with your notice of privacy practice and creating it. If you are a library member, pay attention to right here, compliance rapid solutions. We're going to create a little rapid solution there as soon as we have a chance. But for now, you can go to your compliance courses, go into your HIPAA resources and locate this right here. This has been here for a while because patient access and HIPAA right of access and your notice of privacy practice has been a hot topic for many years. So in that lesson right there, I'm just going to scroll up. You can see, are you honoring your patient's rights? So again, we're in courses, compliance, HIPAA resources and training, and HIPAA patient access. And we're on the site page, are you honoring your patient's rights? So right here we're clicking, and you can notice it breaks down everything with regarding notice of privacy practices. And then we get down here to additional rules like the information blocking rule. And then we get down here and we actually have it in our course, SUD substance use disorder, as well as recommended changes to your notice of privacy practices. So remember, you go to your model notice of privacy practice where it's going to outline everything on HHS site. And you're always looking for information that's under HIPAA for professionals. And then there's other information they released. It's really helpful to kind of know this, especially if your staff needs to, they manage medical records and requests and referrals. They need to know what these things are. What is an SUD record? What does it look like? So this information has been released recently. And then if you just want to understand more about what SUD patient records look like, this is another site. We can kind of look at that URL to make note of that. They also have a fact sheet about the 42 CFR Part 2 final rule. And again, don't forget the templates. That's a good place to start if you're not working with a HIPAA specialist with our one-on-one services. Now, if this is kind of make you scratch your head and go, I wonder how good our HIPAA program is. I really don't even know what a notice of privacy practice is, and I'm kind of lost. Don't forget our free discovery assessment. It's called the HIPAA assessment. It allows us to take a closer look and assess your HIPAA program just to give you some recommendations. Now, mind you, if you want us to help you with your notice of privacy practice, the HIPAA assessment doesn't include that. That's just a look and a report to kind of give you an idea of what you need to work on. The solution consultation is where you'll get that personal assistance. Thanks so much for reaching out to the help desk. And I hope this kind of stamps down some of that misinformation. Don't worry, we're going to continue to give you resources as this kind of develops. But right now, at least we wanted to show you where to go to get those resources.